Hello everyone, greetings from Narayana Health Bangalore. I am Dr. Ravi Kiran, consultant hepatologist and transplant physician in Narayana Health Bangalore. Welcome to this Facebook live session on the occasion of World Liver Day. April 19th, every year, we celebrate this year to create awareness about one of the important organs of the body, that is the liver. On this day, we tend to create awareness about the importance of the good liver health in a person. As we all know, liver is one of the important organs of the body. It is weighing around 1.5 to 2 kgs and it is well protected on the right side of your upper abdomen, well protected by the ribs. It has two parts, left lobe and the right lobe, and it has various functions, metabolic functions, which are most essential for the body function. One of the most important function of the liver is production of the bile juice. So bile juice is produced around 500 to 800 ml per day, and bile juice is important for the digestion and absorption of multiple substances of what we eat, especially the fat soluble vitamins. Apart from production of the bile juice, liver also helps in coagulation of the blood. We know when there is any cut on the body, blood has to stop flowing so that the wound is healed properly. So this coagulation and stopping of the blood flow is an important function of the coagulation factors, and most of the coagulation factors are produced in the liver. So people who have advanced liver disease, they have a problem of blood coagulation. Apart from this, liver is also important in the regulation of blood sugar, cholesterol, and liver also helps in prevention of various infections. Liver is supplied by the blood in two ways. One is the portal venous blood and another is from the hepatic arteries. So whatever the food we consume, it goes into the intestine, it is digested, it is absorbed, and the food and food material which is absorbed into the blood, it has to pass through the liver so that all the toxic material is filtered in the liver and only the pure blood goes high up the body. More than 60 to 65% of the liver is supplied by the portal vein. So if the liver is not functioning properly, the filtration capacity of the liver is disturbed and all the toxic material which are there in the blood can go directly to the heart, and from the heart it can go to the brain. So whatever we eat, either it can be food or it can be any medicines we take. So everything which is absorbed from the intestine has to go through the liver. Unnecessary materials are filtered out and pure blood is filtered. Pure blood is supplied to the different organs of the body. On this World Liver Day, it is important for us to know the measures, how to keep this wonderful organ that is liver happy. So if the liver is happy, most of the other body organs are in a good shape to work, and most of the diseases can be prevented if the liver is in a good and healthy condition. To know the proper functioning and good ways to keep the liver happy, we need to know the causes or the conditions which can cause the liver to be affected. Number one most important cause across the world is consumption of alcohol. As we all know that alcohol can cause direct effect on the liver. So what amount, what quantity or what sort of alcohol causes the liver disease is immaterial. Whatever quantity, whatever sort of alcohol can cause liver disease. When people consume alcohol for a longer time, the liver tries to compensate for it. It tries to avoid the injury. But if a person continues to take alcohol for the longer time, it shows some effect. It may show that the people can have jaundice. Few people who still drink without stopping alcohol, even if they develop jaundice, they may develop very severe liver disease. This can happen in a very short span of time, or few people can have this in few months to few years for that matter. However, whenever there is a development of jaundice in the people who take alcohol, at least at that time, if the people stop drinking alcohol, the effect of the alcohol on the liver can be reversed. So people who drink alcohol should be very considerate and very, they should have a more knowledge about the liver disease which is caused due to alcohol, and they have to stop it at any cost so that their liver functions in a proper way. Another important cause of liver disease is fatty liver. So these days we have seen that the concept of non-alcoholic fatty liver or fatty liver disease is rapid across the world. To quote the stats, around 25% of the world population has this fatty liver. This fatty liver can range from simple accumulation of fat in the liver to causing the cirrhosis. If there is only simple accumulation of the fat in the liver, it may not cause much worry. But if that fat accumulation in the liver starts causing effect on the liver in the form of increasing the liver enzymes, so at that point of time, we may have to be a little concerned and we have to think about the strategies to prevent that progression of the fatty liver to avert cirrhosis. People who are obese, people who have diabetes since long time, people who have hypertension, and people who have abnormal cholesterol levels in the blood, these all are the people who are at the higher risk of developing fatty liver disease, and these people tend to have rapid progression of fatty liver disease to sort of a severe form of liver disease called as NASH and NASH cirrhosis. So people who are having all these risk factors, namely people who are obese and overweight, people who have diabetes, people who have hypertension, people who are taking medicines for cholesterol, all these people have to be aware about the liver disease which these conditions can cause and get appropriately screened for the presence of liver disease. Apart from alcoholic liver disease and non-alcoholic fatty liver disease, the major cause for liver disease across the world is the presence of hepatitis viruses. There are multiple hepatitis viruses. Common among them is hepatitis A, B, C, E and D. These viruses can directly cause effect on the liver. Hepatitis A and hepatitis E can cause acute viral hepatitis, in which the duration of symptoms is very short and they are resolved by conservative management. The important of among hepatitis viruses is hepatitis B and hepatitis C. They can reside in the person without knowledge for many years and come out with symptoms which have at the point where there is pretty advanced liver disease. So it is utmost important for every one of us concerned with the liver health to screen for the people to know whether the patient is having hepatitis B or hepatitis C. Once diagnosed with hepatitis C and hepatitis B, there is no need to worry. There are very good medicines available these days in which hepatitis B and hepatitis C can be treated, and if not treated, they are controlled in a way that progression of the liver disease can be stopped. The liver generally has two lobes, the right lobe and the left lobe. Generally, the liver is a bit smooth, it has a smooth surface and it is firm. If the patient is having some liver disease, it has to progress through certain stages, and it goes to a stage where we call it as cirrhosis, where the liver becomes very hard and stiff. So if we get to know about the patients who are in stage 2 and stage 3, we can still prevent the progression of liver disease to the later stage that is called cirrhosis. The idea of a World Liver Day is to prevent the progression of liver disease so that we identify the people who are having liver disease at the earlier stage so that the progression is prevented, and the ultimate goal is to have a better lifespan and a better way of life. So now the important question is, what can be done to prevent the liver disease? So to prevent the liver disease, the first important thing is to know that if a person is at risk of having the liver disease, if the person is at risk of having the liver disease, what are the blood tests, what are the lab tests, what are the imaging modalities, what we can do to know the stage of the liver disease. So what we generally do is generally screen the people for hepatitis C and hepatitis B in a patient who are at risk, especially for the patient who are at risk. So who are the patients at risk for hepatitis B and hepatitis C? These are the people who have a family member who is having hepatitis B or hepatitis C. IV drug abusers, these are also the patients who are persons who are having high risk, and IV drug abusers, patients with multiple sex partners, and the people who have that branding on their body. So these are all the patients with high risk factors of hepatitis B or hepatitis C. If it turns out to be positive, either hepatitis B or hepatitis C, then we need to know whether the person has to be treated or simply he can be serially followed up so that we can have an eye on his liver all the time. The other important test what we can do is, what we do generally is the ultrasound of the liver. When we do ultrasound of the liver, we come to know how the liver is, whether it is firm, whether it has become hard, or whether it is already in the advanced liver stage. The fibroscan is one of the beautiful technique where it has been used to know exactly how much the liver has become hard. It is a very simple technique of using the concept of the ultrasound, where we use the probe of ultrasound probe to see for the liver. So with the fibroscan, we can come to know the percentage of fat in the liver and how much the liver has become stiff. Since we are using fibroscan, the amount of people who get liver biopsy has reduced drastically. So people have to utilize wherever possible the facility of the fibroscan, which definitely tells you whether the liver is healthy or whether the liver has become firm. So once that is there, then we can always take precautions to prevent the progression of the liver disease. As I told you, in the blood work, we can do liver function test, which gives us an idea how the liver is functioning synthetically. We see enzyme levels, AST and ALT. We see the INR, which is indicative of the coagulation effect of the liver. And we see the albumin, which is exclusively produced in the liver. So any of this abnormality will tell us to go further with the investigations to know the cause of the liver disease. Apart from this, the routine investigations, what we do to know the liver disease is the viral markers, as I told you, and the renal function test, and the common CBC. So once we establish that there is a liver disease, we have to know why that liver disease is caused and what stage of the liver disease is there. Once a person comes to me with an abnormal LFT or abnormal ultrasound, what I generally do is ask him whether he is taking any medicines. Medicines are also very notorious to cause abnormal liver function test and jaundice. And I will ask him about the history of alcohol intake, and I will examine him clinically about the risk factors for fatty liver disease. As I told you before, these risk factors would be diabetes, these factors would be obesity, high cholesterol, and family history of liver disease. And also I screen for the presence of hepatitis C and hepatitis B. So once all these tests have been done, then I check what stage the liver disease is there. There are multiple clinical criteria and scoring systems where we grade the liver disease. So if there is only mild liver disease, then it can be just treated by supportive measures. And if there is hepatitis B and hepatitis C, it can be adequately treated. And if there is a fairly advanced liver disease where people develop fluid in the abdomen, people develop high degree of jaundice, people have this vomiting of blood, then they have to be followed up very closely, and the option of liver transplantation has to be given. The basic idea of this World Liver Day is to prevent the progression of the liver disease from the normal liver to the abnormal liver. So how can we do it is the important question. So as in any other disease, liver can be kept happy and healthy by doing routine exercises, where you can have around 45 minutes of workout every day for 5 days a week, as which has been proposed by multiple societies across the world. So what will that do is it has a check and balance on the accumulation of fat in the liver, and also it helps in improving the insulin sensitivity in the body as well. So apart from that, good diet, healthy diet is most important. As we know, in this generation, or in this time where we live in, so everything we use is highly mixed with rich carbohydrates and fat foods. So that will give us unwanted calories, if you want to say, and that is accumulated in the liver. So that is bad. So we have to have a very good healthy lifestyle, in the sense that we should have proper exercise routine, and also a very, very healthy diet, which can include whole grain diet, which is rich in fibers. Good diet and exercise, what it will do is it will help you to maintain a good body weight, and it has been shown that a normal healthy body weight is directly proportional to the liver disease progression as well. So people who are obese or people who are having unhealthy body weight, I would request them to not waste much time and enroll yourself in a weight loss routine and have a proper healthy diet. People who are having hepatitis B and hepatitis C, there is no need to worry, there is no need to have that alarm ringing. However, it is important for you to know whether that hepatitis B and hepatitis C has to be treated. If yes, as I told you before, there are wonderful medicines available. You can go and get it from your qualified hepatologist. If the family has not been screened for these viruses, please screen for them. So if you take these medicines at the right time, the progression of the liver disease can be definitely prevented. All in all, the mantra for having a good and healthy liver and the ways to keep your liver happy is to have a healthy lifestyle, a healthy diet, and regular exercise. Screen yourself to know if you have an occult liver disease, especially the fatty liver, and the screen yourself for presence of hepatitis B, hepatitis C, especially for people who have a family history of liver disease, liver cancers, and family history of hepatitis B and hepatitis C. So with these small, simple measures, most of the liver disease progression can be prevented. I would request every one of you to adopt these simple measures and lead a happy, healthy life. And you're always welcome to contact us at Narayana Health Bengaluru. We are always available to help you, and you can contact us in person. If not, you can always have a word with us on a video consultation. Thank you.